Hey there, and welcome to our video on iron supplements for pregnancy. In this video, we'll be diving into the complex world of iron supplementation during pregnancy, exploring the benefits, risks, and controversies surrounding this important topic. We'll cover the prevalence of iron deficiency in pregnant women, the potential consequences for maternal and fetal health, and the latest research on the optimal approach to supplementation. So, whether you're an expectant mother, a healthcare provider, or simply curious about this fascinating subject, stay tuned for an informative and engaging discussion. Let's start by talking about just how common iron deficiency is during pregnancy. According to several studies, including those by Chanarine and Rothman in 1971, Dawson and McGanity in 1987, and Pourlaka and colleagues in 1980, iron deficiency and iron deficiency anemia are highly prevalent among pregnant women, particularly in industrialized countries. In fact, Pourlaka's study found that nearly a third of pregnant women in Finland had depleted iron stores, despite routine iron supplementation. So, why is iron deficiency so common during pregnancy? Well, as Fisher and Nemeth explained in a 2017 article, the increased iron requirements needed to support fetal growth and development, as well as the expansion of the mother's red blood cell mass, can be difficult to meet through diet alone. This is especially true for women who enter pregnancy with pre-existing iron deficiency or those who consume diets low in bioavailable iron. But why is iron deficiency during pregnancy such a concern? A meta-analysis by Xiong and colleagues in 2000 found that anemia during pregnancy was associated with a 40% increased risk of preterm birth and a 30% increased risk of low birth weight. Similarly, a study by Skoll and colleagues in 1998 reported that women with low iron stores had a higher risk of preterm delivery compared to those with adequate iron levels. In addition to these adverse pregnancy outcomes, iron deficiency has been linked to other issues, such as low weight for gestational age, increased risk of infection, and even impaired cognitive and motor development in the offspring. As shown in studies by Goldenberg in 1996, Scanlon in 2000, and Zhou in 1998. Given these potential risks, it's no surprise that iron supplementation is widely recommended for pregnant women, especially those with confirmed iron deficiency or at high risk of developing it. The World Health Organization, in their 2016 guidelines, recommends daily oral iron supplementation with 30 to 60 milligrams of elemental iron for pregnant women to prevent maternal anemia, sepsis, low birth weight, and preterm birth. And the research supports these recommendations. A Cochrane review by Peña-Rosas and colleagues in 2015 found that daily oral iron supplementation during pregnancy significantly reduced the risk of maternal anemia and iron deficiency at term. Although the reductions in low birth weight and preterm birth didn't quite reach statistical significance, the trends were certainly in the right direction. But what about women who enter pregnancy with sufficient iron stores? This is where the controversy begins. You see, while the benefits of supplementation for iron-deficient women are clear, the optimal approach for those with adequate iron levels is less certain. Some researchers, like Lau and colleagues in a 2000 study, have even suggested that excessive iron intake during pregnancy may be associated with adverse outcomes, such as gestational diabetes and hypertension. However, it's important to note that the evidence for these associations is inconsistent and requires further investigation. A systematic review by Cantor and colleagues in 2015 found no significant differences in maternal or neonatal outcomes between iron-supplemented and non-supplemented women with normal or high hemoglobin levels. So where does this leave us? Well, the decision to recommend routine iron supplementation for iron-sufficient pregnant women should be made on an individualized basis, taking into account each woman's unique clinical circumstances and risk factors. But for those with confirmed iron deficiency, the benefits of supplementation are clear and compelling. Of course, accurately assessing iron status during pregnancy can be challenging, as hemoglobin concentration alone may not tell the whole story. That's where serum ferritin comes in. This iron-specific biomarker can provide valuable additional information, particularly when interpreted in combination with hemoglobin levels and other clinical factors, as discussed in a 2017 systematic review by Daru and colleagues. As we wrap up this deep dive into iron supplements for pregnancy, let's remember the key takeaways. Iron deficiency is a common and potentially serious issue for pregnant women, with implications for both maternal and fetal health. For those with confirmed deficiency, iron supplementation is a safe and effective way to improve outcomes. But for iron-sufficient women, the decision to supplement should be made on a case-by-case basis, weighing the potential benefits and risks. As always, it's crucial for expectant mothers to work closely with their healthcare providers to assess their individual iron status and develop a personalized plan for supplementation if needed. By staying informed and proactive about iron intake during pregnancy, we can help ensure the best possible outcomes for both mother and baby. That's all for now, but if you found this video informative and engaging, be sure to like and subscribe to our channel for more evidence-based nutrition content. And don't forget to visit nutritionmarket.com.au, where you can find a wealth of resources and products to support your health journey, including our virtual clinic with experienced clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today and take control of your health. As always, remember that while this information is based on the latest scientific research, it's not a substitute for personalized advice from your healthcare provider. Some of the findings discussed may still be preliminary and subject to further investigation. So if you have any concerns about your iron status or supplementation needs during pregnancy, be sure to consult with your doctor or midwife. Thanks for watching, and we'll see you next time.